Hey guys, so I'm sorry this is a day late. Yesterday I celebrated 2 months post-op from top surgery, and I want to update you and let you know how my chest is doing. I'm also going to use this opportunity to talk a little bit about my change in scar care at this point. So I'm going to show you what my chest looks like right now, but I do want you to know that it's not very pretty right now because I just came back from the gym and I have a whole ritual, which I'll explain, of what I put on my scars before I go to the gym, and so it's going to look really flaky and not clean, but it's not irritated or anything. So just saying, all of those things. So yeah, this is all this white stuff here. That's Scar Guard. As you can see, it's like peeling off. So, I know it's dark, so it's a little hard to see, but I posted a picture close up after I took a shower yesterday from the gym. So I was nice and clean, and I posted that on Instagram and Facebook, so you can check those. But basically, my scars are doing really well here. I'll try to clean it off a little bit and get a closer look so that you can see. But basically, I know the lighting's not great, but what you're seeing, is pretty much what's there. It's a little pink because it gets pink after I massage them and go to the gym and put stuff on. But it's really faded. I don't know if you can tell, but this is like hardly noticeable now. And they're really thin, like really thin. My nipples, I'm not thrilled with the progress. They're still marbled and puffy, but hopefully those will get better soon. And as we know, my dog ears continues to get smaller. My nipple area is starting to get less indented because I've been training again, so that's been really cool to start to see things develop a little bit more, and it just makes it clear to me that working out really does help. I'm working out with the blessing and ask of my surgeon entirely, and my nurse practitioner. They've set my limits, and every week I get to use a little bit more weight, and I'm very careful and doing things slowly as long as I feel good. So yeah, about my scar care. So why are my scars already fading and, so thin? So, well, one is because my surgeon, Dr. Alexis Hazen at NYU Langone, is awesome and did a really great job. The reason for those who are catching up now, why I have dog ears, is because I chose to have incredibly thin scars and I had a huge chest, so I knew I was going to need a revision, which I'm going to be having in a couple months, and I'll touch on that later. But another reason why is because I scar really well in general. So everybody scars differently. So there are a lot of factors going into what your scars look like eventually. One is how you take care of them. Two is how your surgeon is and does. And three is just on your body, how you heal naturally, what type of scars you have. You probably can't really tell in the light. Actually, you kind of can. I can kind of see it. Right here, this shiny little scar on my knuckle, that is from when I was, I believe, 10 years old. Had 6 stitches, and you really can't see it. And it's been that way for a very long time, so we're hopeful that my scars will look like that if I continue to take care of them. I do honestly treat them like they're children. I really take good care of them, and you're probably going to think I'm totally crazy when I tell you what I've been up to, but it's been paying off, especially if you look at my pictures, you'll see what I mean. So, in the morning and right before I go to the gym, I do the following. First is I have Trader Joe's vitamin E oil, and I rub it in between my hands, and I massage my scars and my chest for 10 minutes. That's twice a day, so in the morning and right before my workout, which is either in the late afternoon usually or the evening. Once that dries a little bit, then I put on what's called New Gel silicone gel, and I massage that in a little bit onto the scars specifically. That just goes on the scars. The vitamin E oil I usually put all over the place. Then I let that dry a little bit, and then I put on Scar Guard, which is, again, that white flaky stuff that you saw me sort of peeling off there. And that kind of gets hard, and with all of that, I feel pretty protected at the gym as long as I follow my surgeon's orders. I obviously get a little neurotic and check them a couple times, but I'm starting to work on getting better about that, and overall I haven't really seen my scar stretching, even though I initially always have a panic about that after the gym. Then in the evenings, separately, after I've showered, after the gym, I put on Mepitac tape. It's a silicone tape, and it's different than the new gel strips that I was initially using. And I put that along the whole length of my scars on each side, and I sleep with that. And I keep that on in the morning until, I get ready for my day, which is when I do my whole first round of all those 3 other treatments that I mentioned. And between all of those things, my scars have been looking pretty good. I did have a little bit of a different routine initially, but I just sort of through trying different things, I realized that the Mederma Advance wasn't really working quickly for me. The new gel strips were kind of falling off. So I tried taping it, but all these different tapes were making me irritated. The first thing I put on my scars was Neosporin. Then I had like a healing gel. So I've gone through kind of phases, and I definitely believe that certain care products help other people more than others. It, again, depends on how you heal and your body and how you react to certain things. So that's how all those things are going. And otherwise, in terms of feeling, sometimes I get sore or sensitive randomly, but overall they're pretty good. And I've got pretty much feeling, just the nipple area, not so much yet, but yeah, it's healing well, and I'm looking forward to my revision. I think I'll be really just much happier once I have that. And yeah, so 2 months post-op, top surgery. Thanks for watching, guys.